First off, most scientists actually don't have one big idea that influences their field of work. Sid had three, and actually influenced many more. First, as Linda suggested, this notion of measuring the activities of daily living. Second, taking that to another whole area and imagining sort of estimating what active life expectancy is. A great epidemiologist says, well, epidemiology is the demography of health. And so he says, well, health needs an outcome other than death, because death is something that demographers count. Epidemiologists want to count health events. And for him, active life expectancy was that event. And the other was uniform resident needs assessment, resident assessment for care planning, for making that happen. I can't tell you how many careers have been predicated on those three ideas, going in vastly different directions with different applications. The number, I mean, you can't even begin to think about how many dissertations. So he's not just quoted, but people are quoting people who quoted him as their original ideas. So people actually aren't even referencing his work anymore. So this is the 1963 article, which we see a lot. And there were actually, I know, earlier things, which were reports from 1956, but this was the progenitor of the idea in the Gerontologist, and put forward. There was a subsequent piece in the Journal of in JAMA, the Journal of the American Medical Association. And as Sid knows, in the world of medicine, this was clearly always fighting uphill to get something that could be counted like this as an idea in the world of healthcare. Obviously, all of these things are done not just by Sid, but Sid's the sort of the sneaky little idea that is featured through all of them. And then he continued to work on this area. 1970s, another paper, slightly different cast of characters. Also, the way of influencing other people is by getting people to work with him, to play in his sandbox. And then they get covered with his sand, and the sand permeates all of their thinking as life goes on. So I only met Sid in 1982 when he came to Brown, but I mean, I had already been a student of Sid's because he had influenced the people who trained me. The next is a 1983 paper came out. He'd been working on it before he came to Brown, and he worked on it. And Dave Greer, who was the Associate Dean of Medicine, or Dean of Medicine at the time, was also participating. And this is actually a New England Journal article called Active Life Expectancy. And the notion here is to say, take how long you're in a given state of function, as defined by these activities of daily living, before you move to another level of function. Again, a revolutionary idea. But to give you a notion of how important this is the strategic goals of the National Institute on Aging, 2006, still 2006. It's about increasing active life expectancy. And it's the very idea. And so I would guarantee you that most of the people who read this didn't know where it came from, but just had thought that it had always been there as an idea. While he was at Brown, he was chair of an Institute of Medicine committee on the quality of nursing home care, and this was one of the most amazing Institute of Medicine reports, because directly from that report, those recommendations, virtually the same language is incorporated into law. And one of the recommendations emerging from that was the development of a national resident assessment instrument or minimum data set for nursing home resident care. And the fundamental idea here is that you can't deliver care until you know something about the people you should be delivering care for. And with that in mind, this entire structure was put together. And this was fundamentally his notion, his influence in that process at the Institute of Medicine Committee. So at Brown, Sid instituted something called a data archive, and that was his idea, before there was any technology to do that. There were people at Carnegie Mellon who were actually beginning to do this in a totally different area at around that same time. But there was no mechanism for doing that in the world of healthcare or medicine at the time, and it's still the case that if you go to one doctor over here and you go to another doctor over there, they can't actually get their data to talk to one another, or it's very difficult. And part of this notion of being able to assemble information together was very much what Sid had in mind. Even, we spent time talking together about uniform data as we were working on this minimum data set instrument, and Sid was instrumental when he was at Michigan State in working with folks and people, his colleagues at Michigan, who were putting together the first uniform hospital discharge abstract system. First one was in Michigan. Sid was helpful in pulling all that together. He was at the National Center for Health Statistics helping to fund those kinds of things. And the net result is today, I send my students online, they click a little button, up pops a set of tables that they can populate about what kinds of people were discharged with what kinds of medical conditions and where they went to, and you can do that for the whole country. Very, very quickly, and that was an idea, a vision he had quite some time ago. What's interesting is this paradigm of having the data up there and having the data available is sort of this hidden contribution that Sid planted in these ideas, and they've just been proliferating over time. So, thank you very much.